Scientists have put together a shocking video that shows how deadly virus droplets can spread across 2 supermarket aisles and infect shoppers, with the bug hanging in the air for several minutes. Experts from Aalto University in Finland have put together an animation so shoppers can be aware of the dangers of spreading the killer disease. Someone infected by the virus can cough and walk away, but then leave behind extremely small aerosol particles carrying the virus.
Over here is the catching effect of the mask. So,
according to our professional experience, a simple homemade mask can prevent up to 100% of the spread of potentially infected microdroplets.
The more people use masks, the less virus can be distributed and fewer individuals are exposed.
Near zero droplet spread communities, mask catching 95 to 100%. Mask blocking now improves to 99 to 100%. So the mask ratio, the work ratio is 98 to 2 or greater. So we're talking about public places. So here it's always with no face masks and no wind. We know these droplets can go 9 meters easily. So with a mask, and that can catch up to 100%. And then the blocking mask now can, and there's our ratio, and this can be greater. Distancing, of course, improves everything. So over 2 meters is safer, and less safe is under 2 meters, of course. Mask blocking alone is a lot of work to do, and has to catch all the droplets. Over 90% of infections are caused by asymptomatic people with not wearing a mask, and we don't know who they are. No infected person has the right to infect their communities or cause the death of other people who are not wearing a mask. Mask wearing by all stops droplet spread. So the mask catching action reduces.
Apparently aren't enough to compel Donald Trump to wear one. The CDC is now recommending people wear cloth masks while out in public to help curb the spread of COVID-19.
A month ago, as an electrical engineer, I knew that the masks had a 2-stage effect. So I drew it on an electrical circuit to try and have it all in my mind real simply. So this is a COVID generator. This is the infected person, the unknown infected person. This is the only resistance. It's a big resistance. It's the biggest killer of virus of all, and that's the natural virus decay, the outdoors, the UV sunlight, and all that. So that knocks it down a lot. And then, but what's left over is still an amount to cause pandemic spread, which is your infected masses. So the next one here is the COVID generator, the unknown infected person. And he's out in the community, but he's wearing a face mask in this case, which is a blocking diode or a xenodiode. So that's blocking up to 100% of droplets going to surfaces in air and affecting others. The next thing we have on top, if anything does get outside, is we've got natural virus decay, another big killer, but it's very small now because nothing's getting out. And the next one after that is distancing. So that's another good size resistor. And then after that, there's the combined effects of hygiene and stuff like that, like hand washing. That is very insignificant compared to this now. And the mask wearing here, the blocking diode here, face mask wearing blocking diode, that takes the pressure off relying on hand washing, sneezing into the elbow, all that sort of stuff. Sneezing into the elbow is really a weak form of mask catching, actually. Then the next one, of course, is the last one. There's very little pressure on this face mask now of the uninfected person, so that can easily catch up to 100%. So that face mask's got no load on it now. This blocking diode's taken 100%, and the ratio is more, but 98 to 2. This is catching 98 to 2. There's one thing why we're down to a 98 to 2, not 99 to 1, and that is because we've got a leakage resistor up here, and the leakage resistor are people that aren't wearing masks or going home infected where you're not wearing masks and stuff like that. So we do have a leakage. So the more people who aren't wearing masks in communities, the more leakage we have, more deaths, more infections. So yeah, so that's the big one, 98 to 2 ratio.
No infected person has the right to infect their communities or cause the death of other people by not wearing a face mask.
Here's why you need them. If you go to a shop and somebody there is not wearing a mask, they could kill you. We've already seen this on public transport. The bus driver who died and somebody on his bus coughed without wearing a mask. But it's not just coughing, it's talking. We actually know talking is the main way this thing spreads. So we need to make sure if you're going to be safe in your community, go to your shop and demand that they have a no mask, no service policy. That's going to keep you safe. Otherwise, you go in that shop, person behind you not wearing a mask, they could kill you, right? This is a public health issue. This is not a personal responsibility thing. If we get 80% of people wearing a mask, it could save your life, it could save the economy, it could put us back on track.
And it apparently is not that difficult to make them. You can sort of make your own, right? I mean, some people are even doing initiatives where they're just making them.
Drink up. These ladies do more than 270 every 3 days, and in 4 days we did 100,000 masks by using.
Wear a face mask. That's one of the big questions people all over the world are asking at the minute. This week, Singapore made wearing masks compulsory in public, and in the state of New York, they are also required whenever social distancing is not possible. But many countries are still advising people not to use them.
But now the thinking has changed. How so?
Yeah, so we have more and more evidence. So we've known actually for a while that asymptomatic people who have no symptoms at all, can spread the disease. But that data has now really become crystal clear, I would say, over the last month or so. And therefore, when you're out in public, you're at a grocery store, you may be infected, you may be spreading the disease, but have no symptoms at all. And it becomes really important that you put on that mask.
So a long time ago, that's me in there.
What Donald Trump had to say about this idea of wearing masks. So this is despite the fact that the CDC now contradicts him. Here he is on Friday.
The CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. You can do it. You don't have to do it. I'm choosing not to do it, but some people may want to do it, and that's okay.
So, yeah, Donald Trump's never done masks. I worked in there and we've strapped our face up before, and material really does stop everything. So material, as Jeremy Howard and those guys are pushing. And yeah, so we've worked with it. And back to the ratio of the combined effect.
Again, Mr. COVID, this time, we're going to block his mouth. So this is our mask. So just coming back to our two-stage effect of our mask, our 98 to 2 ratio. So in this situation, this effectively is the mask. So there's the COVID person, and they're coughing out, and you can see here the mask is catching, up to 100%. So we've got our COVID person going through society up here, and he's going around a society again. But this time, all these droplets that would normally go into a community are caught by the mask. And then it stirs around. So the mask is catching all this. The next thing it goes into the community zone. And this is the outdoors. The first thing that kills the viruses, and the greatest thing of all virus killing, is natural decay. Natural decay is the outdoors, the UV, the sunlight, and it gives the viruses a very short lifespan. So what's left over by maybe non-mask wearing people in our communities, or what the mask may not catch, goes out into our outdoors. From the outdoors, the next thing that really helps is the distancing. So if we're a distancing community, we can't touch this sort of stuff. We're keeping away. So that goes in. So this is distancing. The next thing from distancing is our hygiene. Now, hygiene doesn't have the pressure it had on it in the before example, because hygiene, of course, everything's caught at the mask. There's no droplets on the ground. There's no droplets for 3 hours in the air. Droplets on the ground can last up to 9 days, 4 days, 3 days, depending on the settings. Like in a hospital, they last a long time. So they have to have high hygiene because they don't have an outdoors community setting. They don't have sunlight. So it's very different. So finally it comes in, and then our little hygiene, we wash our hands when we get home before we go in the house. So we're looking very clear. Then the last thing is the mask wearing. So this is the mask wearing. Now this has got almost no pressure on it now to catch anything because we've got a low contamination community. So this is coming in, and then anything coming, this mask now, it's very easy to block 100% of droplets. It also stops us touching our faces as well. But even if we touch our faces in this setting, there is no contamination. We've brought it down to near zero levels of zero. So we've got our person here masked up. We grab our community, and there's nothing coming at him. He's very happy, he's safe, and we've got a far better thing. So just a last topic. So this is really, this a major thing against masks. So our fabric masks that we're making in the villages, they've got a pocket. Now we can put this in the pocket, just a folded piece of paper towel. It's the same as this. And we can put this in the pocket. Now that gives us better with a fabric mask, better than this. Our fabric masks are superior. These things only last days, even the N95. So how can poor countries even afford these and then have to buy them again and again? How can they get them in through containers, through shipments and factories, and then out to the village, where the village can make a mask very, very quickly? We're making, one village lady can make 270 in 3 days, 270 masks, and these can be popped in. So these masks going out there are really important, and the mask wearing people of the world, they've stopped our project from starting a lot earlier. We were making masks for our disabled, and we were held back because of the comments from people who didn't understand, because World Health Organization. Even our own governments have blocked us, and that we're in horrible lockdowns now. We're a low contaminated risk in New Zealand. We only needed to have people coming off the airports with these on. We only needed to have all our workers who are out there now with masks on, our bus drivers and all this. We can make masks in days, and it's not being told. It's being told to sneeze in your elbow. Well, most droplets are spread just by talking. And so sneezing in the elbow is not doing anything. Sneezing in the elbow is like a nothing mask, but it's doing the same action as the mask. Stopping.
What we need, or we don't need, any cover is fine. A scarf, a bandana. Actually, research that's about to come out shows that any kind of cover stops 99% of droplets. But here's a good one based on research from Cambridge University and Chinese scientists. 2 layers of cotton, okay? And then in the middle, there's a special magic material that Chinese scientists have discovered is almost identical to surgical mask material. It's called a paper towel. So you just need 2 layers of cotton with a paper towel in the middle. And actually the Surgeon General has a demonstration of how to make one with a simple handkerchief. If you pop a paper towel in the middle, you've got your ideal mask ready to go. Taiwan and Hong Kong, they were pretty close to the, kind of the epicenter of this pandemic. They had people on the ground in Wuhan. They saw the asymptomatic and pre-symptomatic spread. And so they very quickly realized, okay, everybody needs to wear a mask. They already had the mask wearing culture because they have, unfortunately, a history of respiratory pandemics in that region. So they know about the importance of masks. And with this vital new scientific fact, which is you can transmit the disease even if you don't know you have it, very quickly everybody realized we need everybody wearing masks, otherwise people are at risk.
And briefly, Jeremy, your advice then to anyone in a city with a significant coronavirus outbreak, as well as social distancing, would be simply to wear a mask.
Yes, and really any mask, you can literally take a piece of paper towel, you can staple a rubber band onto each end, and you can stick it over your face, and that is incredibly effective at stopping the droplets.
It's Dr. Ashish Jha, director of the Harvard Global Health Institute, and Jeremy Howard, founder of Masks for All. Thank you all for being here. Dr. Jha, I'm going to start with you first. To help stop coronavirus, everyone should be wearing face masks. That's actually Jeremy's piece, so I won't give you that piece. But can you explain the difference in thinking? Because the original thinking was masks were more important for somebody who's already sick to prevent other people from getting sick. And you wrote, every country with enforced mask usage shows dramatically lower death rates compared to countries not using masks widely. Our affiliate in Miami, my former place of work, has noted that Miami Beach, the city of Miami Beach, has ordered employees and customers in stores to wear masks and facial coverings. That's as of Friday. Talk about your initiative to make sure, because there's one thing to say wear masks. The second thing is, how do you get them?
Yeah, so there's a couple of important things to know here. So as the doctor mentioned, the science is now clear. A Nature article that came out just showed that 100% of the time the coronavirus was blocked by a simple cloth cover. So you don't need a fancy N95 respirator. Leave them for the hospitals where they're doing dangerous procedures. You just got to cover your mouth. If you don't do so, you're protecting those, you're putting at risk those around you. And if you go out and see somebody else not wearing a mask, they're putting you at risk. This disease is a silent assassin. So the closest we have right now to a kind of imperfect vaccine is to cover up your face. The advisor on this to the WHO says this might be even more important than distancing, but that's how important this is. So it's not enough for you to do it. You need everybody in your community to do it, and that's why we need enforcement on this. If we hit a magic number, the number is 80%. If 80% comply, modeling suggests we can actually kill this virus off. Yeah, so it's so easy, even a data scientist can do it. I'm a data scientist. I made my own mask. I will admit it looks kind of rather rubbish, but my mother-in-law took pity on me and made this one for me.
All right. Well, that is a very good advice. Thank you very much, Dr. Ashish Jha. Thank you very much. And Jeremy Howard, thank you very much as well. Y'all be safe. Thank you. And up next, reckless information is putting American lives at risk. New York Attorney General Letitia James is here to understand the science behind this. I'm joined by Jeremy Howard, a scientist at the University of San Francisco and co-founder of the FAST.ai Research Institute. Jeremy, thanks for joining us. You've reviewed the research around face masks. What are the main things that you found?
Yes, I'm the lead author on the latest study here, which is a cross-disciplinary international review of the evidence around face masks. For example, Taiwan and Hong Kong, their economies largely continuing as usual with just a few social distancing measures, but not a lockdown. And they only have 10 deaths each, despite Taiwan, for example, having a population of 30 million. They're doing the testing, the tracing, the quarantine of potentially infected, and face masks. There's a magic 4-piece solution, which we're already seeing working, and face masks are part of it.
Yeah, it's really interesting you mentioned Taiwan and Hong Kong there. Why is there this divide between Asia and the West over this? Because countries that you mentioned, Japan, China, Korea, Taiwan, Hong Kong, masks have been the norm for quite a few years now.
Well, there's been an important change in East Asia. Masks have been the norm for people with symptoms. And unfortunately, that doesn't really help in this case, because we now know that about half of the infections come from people that don't have symptoms at the time that the infection happens. So what happened is in time, it won't necessarily keep you safe from those around you, but it'll keep those around you safe from you. So if you make sure that everywhere you go, everybody's wearing a mask, that's going to do a great job of keeping you safe. So we really need help here from governments, from unions. And so London today, the London mayor is saying, we want to enforce masks throughout our city, and this is why.
Jeremy Howard, really interesting to talk to you about that. That's Jeremy Howard live there from Houston in Texas. Thanks so much.
So what's the problem with getting masks in the poor countries? This is the problem. There's still a lag effect of all this information. Do not wear a mask if you are well. Western government false public information, and it's all plastered everywhere. It's the most deadly COVID-19 message by Western people, and it's going to kill a lot of people in poor countries. This is everywhere. This girl's got blood on her hands. Even trying to share our story in Facebook groups and stuff. And so these ladies take a lot of, they deserve our support. Thousands of people like Maria And so we need Facebook groups to share, and we need to tell the story, and we need funding. So this is where the movement for Masks for Poor have come in, and that's us. And of course, without masks, and why should people be in fear of risk or risk for death because of non-mask wearing people? So a safe planet and an unsafe message. And it's crazy this is out there. Do not wear a face mask if you're well. It's just absolute, it's just going to destroy poor countries. And, you know, we understand that they didn't want face masks worn by the public because they wanted to protect them for the medical world. But
now, with that being said,
this
if somebody
message,
wants to,
not prioritizing.
most people can just make something out of a certain material.
So he's been told we can make masks.
Designated. It's very simple to do. I won't be doing it personally. It's a recommendation, okay?
I won't be doing it personally. World Health Organization telling poor countries mask wearing is not necessary.
At a media briefing in Geneva on Wednesday, while people around the world are debating whether or not to wear face masks to protect themselves from the COVID-19 outbreak, the World Health Organization claims healthy people do not need to wear the face mask just yet.
So, yeah, this is all behind us now. You know, the planet's not flat anymore, it's round. And no one's got the right out there to infect their communities or cause death of other people by not wearing a mask. So just informing research of virus catching is a real problem. So we've got teams out there making hundreds of thousands of masks now. It costs us very little. We spend about $6,000, and we had enough material, and the material to 100,000 face masks in just 4 days by using these village ladies. And this is the working capital. So we can see in Indonesia, there's 20 million ladies with sewing machines. There's 270 million people. We're going into different regions now, but we need to amplify this message. So we've done a million, we're cracking out the other side, but COVID's coming to these poor countries. They're really worried. So, you know, we need to amplify it. This is Henry.
Halo semuanya, yang terhormat Bapak Presiden Republik Indonesia Bapak Jokowi, para gubernur, para bupati dan para wali kota yang ada di seluruh wilayah Indonesia. Selamat datang di di Lombok Disable Center Masks for Millions. Jadi di video ini saya ingin menunjukkan bagaimana kemudian kami bergotong royong
with these boys, and we started with our disabled teams. And then our disabled teams of the pilot project, this is 3 months ago. We learned which masks to use, the fastest ones to make, with puppets and all that. And then we started to work out how fast we could make them, and then we started taking this message into the village. So here's a tutorial that was nicely made by the Bali teams, and they're just getting going now, but they made a very good video. So that's the video we chose. We chose this video because this mask, it's superior. So it's like a surgical mask, and for wearing for the infected person, it sort of bellows out a bit more rather than the tight-fitting one. It's got the pocket, very easy to make. We can bang these out in 10 minutes. And you can make them with stretchy or with strings. We ran out of elastic, so we went to this making the strings. And the other good thing is it's just a square size, so we get 100% out of our materials. 45 centimeters by 21 centimeters. And this concertina is down. Also, it gives, by concertina down, it gives a lot of surface area on the mask for catching, or for blocking. For catching, yeah, and blocking, it's good too. Very comfortable mask. And I can see why the surgeons use it. You know, the surgeons use it to not to protect themselves, but to not infect the people they're working on.
Setelah patrun selesai, potonglah kain sesuai dengan ukuran patrun.
So this is in a tailor's setting, but in the village they've got all the ladies sitting around, and they're cutting, and then they're pinning them together, and it's going through these machines like crazy. And when you've got thousands of ladies doing this, you really are outputting it. They can do a village of 1,000 in 3 days, just small village ladies just doing it. They just need the material supplied. Their village leaders can supply it, so we tend to have to start the pilot projects first and then and sort of nudge them take over. And a lot of this is because of the propaganda out there in the world saying it's not important, so they're still clinging on to hand washing and that, and it's just going to be bloodshed, you know, unless they cover up their faces.
Selanjutnya, lipat bagian sisi dengan ukuran 3 cm.
20 centimeter fold, 30 centimeter fold, 30 millimeter. The machines in the village, we've got them hand stitched. The hand stitching together are quite fast actually. They can stitch these together fast. We've got them on windy handle machines. With most of Indonesia's masks at the moment, the million that we're coming out the other side of 1 million now, are being made by the treadle machine. No power is required, and they just use the foot treadle, and that's making these fast. It's surprising how well those things go. It's almost as fast as these machines. And of course, we don't have logistics. The materials nearby, we can either send money, $50, funds 500 masks for a village. So that gets them going. And then they've also got government funds that can come in that should be spent on masks. And our call is to try and get out to Jokowi, the president, and call a national thing for making masks. In 4 days, they could make 270 masks. They've got 20 million ladies at least with machines, and they can protect them. They just need to know that 20/80 rule and why we're doing it. So instead of running around and doing the sprays in the village and all that. The other thing, so the first part of our project is to mask up, for our foundation, is to mask up the old people and all the sick people and our 2,000 workers. So I've got a big point of difference from everybody else, and that is I'm going to see my best friends, my teams. We've got 100 foundation hubs and they're going to die. So this just breaks my heart. And so we've been working on it for 3 months. We've had to drop all our other work, and we're in the TV and all that, national TV, trying to get this message out fast. But the end of this project is, of course, to get other poor countries. So if Indonesia can make masks for 270 million, every country can. We've got teams in Uganda and that, and the police are stopping them from putting masks out in the street for fear that it's inciting fear. It's not. It's like going out on a boat with a life jacket on. It doesn't incite fear. So we've got these crazy wars, and it's all World Health Organization created. It's all Donald Trump created. It's all the Surgeon General. If you go back in time, history's going to prove these guys. There's a lot of blood on their hands. So we need to make mask making now. And I'd love the John Hopkins Centre to look at the 20/80 mask making ratio so that they get 98:2 ratio. And Jeremy, you guys you're part of our foundation and our movement. And we really need to get this message out. It's not about America. America can make all its breathing, and that the poor countries just don't have the hospitals that are going to back this up. The medicine's going to back this up. But we all know, all us guys in the team know that this is going to really significantly halt and can drop it, whether they're in a pandemic state, recovery state, or whether they're facing this this problem and they can stop it before it even gets there. And Chris Madison, you've been fantastic too. From the beginning, you're the first person to come in and comparing our own data about the effectiveness of materials and the ratios. We all predicted the share market crash a month before it happened. On the day, we predicted the American mess. We predicted the Italy and all those sad numbers. England with its herd effect thing that's just not going to get there because the virus, 30% of people get no immunity at all, and then the rest, it only lasts for 6 months, a year at best. So the herd thing's not an option to rely on. It helps a bit, but masks are the thing to do. And these lockdowns are crazy. We could have masked up and stopped these lockdowns in a lot of these countries. America, I mean, you guys have got what you've got, and it's sad, and you know, Donald Trump's really swinging it. So there we go. There's a mask with a pocket.
Pada kantong masker, kita bisa tambahkan lapisan
Very,
lagi
very
seperti tisu
simple
atau
and
kain
easy.
yang bisa dilepas atau dicuci.
And they're really a good mask. For poor countries, this is by far the best for its ease. Everybody do it. Low material use. Its output of speed. And we've got kids sewing these up. So, you know, anybody do it. You don't need tailors or cuttings. So these are our teams. This is just in Sumbawa, new provinces coming. This is Lombok. Lombok's been in, we worked in the earthquakes down there, and the people in Lombok have been under earthquakes, and they lost a million people lost homes. And so these guys are responding very well. They're not listening to, they don't have a Western, like Bali's got a lot of Western propaganda. This sort of information came to us, you know, the effectiveness of materials. So that was really important. So long video, so many people to thank. We really need some funding. We've drained ourselves. We've only spent about 14,000 for this whole project. New Zealand dollars, you know, 9,000 US. And it's been hard to get. Nobody's been backing us just from the beginning. So this is sort of like our story. So Maria, no one will fund Maria because of all what we said. So there's Maria, and she's got a machine, and she can output, and she just needs $50 and she'll mask up her whole village. We had to drop a project, Water for Billions. So that's one of our things. It's hopefully we'll talk to you guys about it more later, Jeremy. And then Mask for Millions, we kicked in movement. We are a emergency aid foundation. We've got 2,000 volunteers. We started from nothing. The 26th of February, we had to refocus. We'd already started the planning. Then we used our disabled team on 5th of March. They started making it. These are disabled people, and we had sewing machines. Very, very small team. And we tried many, many masks. You can see them there. And we started making the masks. I wanted to get our guys safe. I was really worried. I can't explain how horrible it was to think these guys are going to take COVID unprotected. There's Andre with the media. So we're kicking into the media. We worked really hard to the media and try and get working with that data. And we actually seeded Indonesia's government, Jokowi, and that by nudging and getting information out. And they went into, from the stupidity of before in paying for fuel to keep tourists coming in, they went in and they made mask wearing compulsory, making it easy for us now, but people still don't have them, and still a little bit. So we need him to get behind that. And then the next part was the endless research and influencing of governments and local governments. Then on the 26th of March, we discovered some important connections. These guys don't know it, but they're our founding partners, really. And so they're on the other side of the world, and we're thinking the same. And then it was so good and refreshing to come in and see that other small voices were trying to get going. And Dr. Madison, your updates have been just world. We got an island for setting up. We had the Holt Monkey Island. This is a base we want to have for research and poor country innovation. For doing this, I'm stuck in lockdown. I could have you guys down. We can meet up and we can do. There's so many things that we can do to get information out. This is our project on the island. Outbound Komodo, Haters Outbound Komodo. So that's stopped. There's the island in the background. It's in the Komodo National Research Park. So we're right on the edge, right next to the town and restaurants. So we're looking forward to having overwork bungalows and hosting you guys, and maybe having your own bases there so you can get away and do frontline work for free. So that's a big dream of ours that we had to put on hold. Our earthquake center and hospitals, these are the guys making it. 28th of March, we're getting out in the villages for $14,000. That was our first ramping up to the million, thanks to the combined effect. But we've got to get going faster now. We need the funds, we need the help. And there's the lady, including the cat. This is typical teams, very small sewing machine you see up there on the right, really, really small, and it's outputting in big amounts. And there's the machine on the table, and they're just working hard. They've got the fear in them. These are our teams now. We've always been with the police, so we've got these police out there, and we're stopping these kids not wearing masks and making it serious and giving away free masks from funding. But again, the funding's just hurting us too much. But we're still making them. This is yesterday front page of the local paper for 5 million people, of the guys you can see in the center there fitting masks. So we need more of this. We're doing it every day, but we need to get national, and then we're back to where face masks don't work and the movement there. And this is our foundation, Lombok Forgotten Children. We just have to thank everyone so much, either behind the scenes, our backline guys who are funding it where we couldn't get funding, and really have to thank so many. Rafiq, thanks. Ed for getting Kuta going. Endry and your team, those guys, and swinging it around. I mean, this is going to be a mess. We're just starting to get into it. So hopefully the guys can support us. We get a few small funds. $100,000 would do the whole of Indonesia, just to start small startups where there isn't any funding, and then we can get the government to follow. So yeah, thanks all.